Welcome, ladies and gentlemen. In the following few minutes, please let me introduce my progress in my PhD topic, which is about a translational approach for better awareness of cystic fibrosis-related glucose abnormalities. As well as I'm a PhD student, I'm also a pediatric resident who is involved in the clinical care of children with cystic fibrosis. Therefore, my mission and my vision is to improve the life quality of these children and extend the life expectancy of them by improving the clinical assessment of cystic fibrosis-related glucose abnormalities by applying up-to-date scientific research. To estimate the significance and to assess the global and local prevalence of this cystic fibrosis-related complication, we are conducting a cohort analysis and a meta-analysis. The life expectancy of cystic fibrosis increased in the past decades thanks to new therapeutic options. Therefore, complications that need time to evolve, such as osteoporosis or diabetes, has come into light. By the age of 40, approximately half of the patients has cystic fibrosis-related diabetes. The diagnosis of diabetes is associated with increased mortality, which can be avoided by early recognition and treatment. But we have to think about diabetes as the end stage of a progressive disease, the abnormal glucose tolerance spectrum. Before diabetes, there are prediabetic conditions, such as impaired glucose tolerance or indeterminate glycemia. Basic scientific research suggests that these prediabetic conditions start at early ages. Despite that fact, oral glucose tolerance test, which is the gold standard method for diagnosing abnormal glucose tolerance, is only recommended from the age of 10. And therefore, characteristics and dynamics of the progression between the different glucose tolerance status is still unclear. That's why we would like to know the exact prevalence of abnormal glucose tolerance in different age groups of cystic fibrosis. We hypothesize that this glycemia is more prevalent even under the age of 10 in patients with cystic fibrosis compared to a healthy population. After the systematic search and the selection process, we included 625 studies in our meta-analysis. Due to the vast amount of data, we have examined several outcomes regarding the whole spectrum and each of its subtypes. The size of the circles and the number it represents the number of studies included in each outcome. Now I would like to talk about the three major outcomes signed by the red circles. Firstly, we examined the prevalence of abnormal glucose tolerance, the whole spectrum in different age groups of cystic fibrosis. According to the results, as you can see, the prevalence of abnormal glucose tolerance is high in cystic fibrosis, with 37% in the overall population. Interestingly, the proportion is even that high in every pediatric age group and rises with age, and in the adulthood, half of the patients are affected by this glycemia. If we look at the proportions and comparing them to the global prevalence data about abnormal glucose tolerance according to the International Diabetes Federation, we can see that abnormal glucose tolerance is much more prevalent in cystic fibrosis compared to an age-matched general population. Secondly, we examined the prevalence of diabetes, the end stage of this disease, in different age groups of cystic fibrosis. As you can see, it's still highly prevalent in cystic fibrosis, with 15% in the overall population. As you can see, it's even that prevalent in the subgroup, pediatric subgroup, to 5 to 10 years of age, with 5%, and increases with age, and in the adulthood reaches 27%. Comparing these proportions to the global prevalence data about diabetes according to the IDF, we can see that diabetes is much more prevalent in cystic fibrosis compared to an age-matched general population. In this figure, you can see the age dependency of risk ratio, the cystic fibrosis-related diabetes risk ratio. As you can see, it increases with age, most rapidly during the puberty, but that increase starts before 10 years of age. And I have to emphasize that it's just end stage. Of course, this meta-analysis has its strengths and limitations. is the first meta-analysis examining the whole spectrum of abnormal glucose tolerance and each of its subtypes, including high number of studies with high number of cases. But the age groups and the definition of the outcomes are not equally detailed in all of the studies. And there is a high heterogeneity because of the involvement of the different superselected cystic fibrosis population. But with subgroup analysis, we earned further knowledge about the superselected cystic fibrosis population, but unfortunately, I cannot show these results during the lack of time. In conclusion, I would like to say that abnormal glucose tolerance is highly prevalent in cystic fibrosis, even under the age of 10. Under the age of 10, only 15% of the abnormal glucose tolerance cases are end-stage diabetic, whereas among the teenagers, third, among the adults, half of the patients are diabetic. I have to emphasize that diabetic patients have already lost the possibility for early intervention and treatment, which could have slowed down the disease progression and could conclude to a better life quality. Therefore, better awareness is needed for screening and treating abnormal glucose tolerance, especially under the age of 10, where most of the cases are still reversible. It's time to reconsider the current guidelines and start OGTT younger than the age of 10, and after the diagnosis, start dietary intervention as soon as possible. And there is a burdened desire for a patient-friendly screening method, which is suitable even for toddlers who cannot drink the sugar liquid needed for oral glucose tolerance test. Currently, we are finalizing our data analysis and writing our article. What is the proportion of abnormal glucose tolerance in the Hungarian pediatric cystic fibrosis population? The Cystic Fibrosis-related Pancreatic Disorder Registry is aimed to assess the prevalence of abnormal glucose tolerance in our registry population, especially under the age of 10. Currently, 105 patients are involved in our registry, from which we have analyzed the baseline data of 79 patients whom were able to undergo oral glucose tolerance test or whom were previously diagnosed with diabetes. The OGTT was performed for 3 hours, measurement in every 30 minutes. As you can see, it's a longitudinal study, a prospective study, which aim is to earn further knowledge about the characteristics and the dynamics of the progression between the different glucose tolerance status by yearly follow-up visits and yearly reevaluating the patient's glucose status. As you can see, more than half of the patients had 2-year follow-up visits, and we just started the 3rd-year follow-up visits, so the 2022 numbers will increase. According to the baseline results, you can see that abnormal glucose tolerance is highly prevalent in our cohort study as well, with 30 to 40% in every pediatric age group. Even under the age of 7, where 9 of the patients have diabetes, and which increases with time, and in the adult population reaches 30%. Here you can see a table with the 4 glucose tolerance status and the baseline characteristics of the patient. As you can see, the more progradiated is the glucose tolerance status, the worse the lung function and the bacterial colonization by looking at the forced expiratory volume parameters or the tendency in the chronic Pseudomonas aeruginosa infection. Our results of our cohort analysis harmonize with our meta-analysis, since both underline that abnormal glucose tolerance is highly prevalent in cystic fibrosis, even under the age of 10, where screening is not mandatory according to the current guidelines. However, early diagnosis and treatment is crucial, as an uncontrolled glycemic status leads to rapid clinical decline. And thank you for your attention. However beautiful the strategy, you should occasionally look at the results by Winston Churchill. And thank you for your attention, and warmly welcome any question.
As I remember, the prevalence of the in the AGT plot is lower in the age group between 5 to 10 than 0 to 10. What is the reason behind this?
Thank you for your question. I try to go back. You have an excellent eye because you have spotted this. As you can see, it's really a little bit higher, but we have calculated and the difference is not significant here due to the wide confidence intervals. And as you can see, there is much less study involved in this age group. So it could be due to confounding factors. And we have to emphasize that in this age group, the abnormal glucose tolerance majority is still reversible, so it could be due to that, but I would guess it's mainly because of confounding factors, because it's the cumulative prevalence.
My question is regarding in your second project. Can be the FEV decrease only because of the older age, or there are other factors to influence it?
The FEV decreasement is, we can see FEV decreasement because of the increasement in age, but that much increasement could it be just because of age? It's mainly because both of them, I have to emphasize it.
Probably you know that in this year we started a nationwide newborn screening for cystic fibrosis. Do you plan to check the natural history of the development of the glucose abnormalities if you have the whole data set from 0 point to during the follow-up?
We would like, thank you for your question, it's an excellent one. We would like to check the whole characteristics and dynamics of the progression, but to do that, we need measurement, a diagnostic tool, which is suitable for younger age, so toddlers, babies. So it could be the continuous glucose monitoring, because they couldn't drink the sugary liquid for oral glucose tolerance test. So we would like to do continuous glucose monitoring, randomized control trial. It's under planning.
Yeah, because it was very wonderful knowledge about that. So what is the natural history of the development of glucose problem in cystic fibrotic cases?
Did you examine studies that included non-CF control groups while you compare the risk to diabetes?
Yes, we have done that, but unfortunately there was only 12 to 15 studies who used control groups, and they were not always healthy people. Sometimes it was also transplanted patients with other pulmonary disease. Interestingly, we calculated odds ratios. The odds ratio was high in every subgroup, for example, in the transplanted patients as well. So patients who were transplanted with cystic fibrosis have a higher risk to have diabetes than those patients who was transplanted, but not because of cystic fibrosis.
You mentioned the confounding factors. What is the reason for the difference of the prevalence or the proportion of the abnormal glucose intolerance? And I would like to ask, what are these confounding factors, and do they adjust their results to these confounding factors?
Thank you for your question. The confounding factor could be that this age group, especially this one, is not really investigated really well because of the difficulty in the measurements, the diagnostic tool, as I mentioned. And this is because the low number of articles and low number of patients involved in these studies compared to this population, which are higher number of studies with higher number of people. That could be one confounding factor. And I have to emphasize there is a lack in the age reporting, so they do not really reporting the age groups well in the studies, and that's we will suggest to develop a detailed age reporting system and unified age reporting system, because that was one difficulty in our studies to investigate it.